So I hope you found that short video by our REACH Youth Advisory Council insightful, as I did. I'd now like to take a moment to introduce our first featured speaker of the day, Dr. Leslie Walker Harding. Dr. Walker Harding, whose pronouns are she, her, is the Ford Morgan Endowed Chair and Professor of the Department of Pediatrics, as well as the Associate Dean for the University of Washington. She is also the Chief Academic Officer and Senior Vice President for Seattle Children's Hospital. Dr. Walker Harding has been dedicated to the health and well-being of children and adolescents for over 25 years, particularly in the area of prevention of adolescent substance use and promotion of healthy adolescent development. She is also co-chair of the Forum for Children's Wellbeing at the National Academies of Science, Engineering, and Medicine. So please join me in welcoming Dr. Leslie Walker Harding to the stage.
Good morning, everybody. It's really great to be back here again. I was here maybe 2018, and I got to present, so it was really an honor to get to be called back and present again on substance use. I hope to go through my slides so that we can have a good amount of time to ask questions and talk. I think at different regions in the country and what's happening with substance use in adolescents can be different. So I'd love to hear some perspectives on what I'm presenting and some thoughts about how you're dealing with it here in Michigan. So the goals for this session is one, just to review adolescent vulnerability to substance use and current trends in adolescent substance use, discussion a bit of cannabis in youth, and why prevention is important, and how in primary care we can really do a great job in early prevention, early intervention, and in treatment. And I like to always start out by saying that, substance use is a pediatric disease. And what has always made me very excited about treating this population, working on prevention, is that it is 100% preventable. We can prevent this, and if we address it early, we can help people to come into recovery and live a really full and great life. It's much easier to do that when people are younger than when they're older. So it's actually, to me, very hopeful that we have some very solid ways to prevent substance use in adolescents. And if we identify it early, we have really strong ways to help make people be able to help themselves and live a productive life. So when you think about, what's the difference? And we'll talk about the new scheduling that the Biden administration is doing, taking cannabis from Schedule 1 to Schedule 3. Schedule 3 actually means that it has low potential for abuse and low potential for dependence. Now, if you think about adolescents, though, they're not really taking into that account. Substances, and in particular things like cannabis, adolescents' brains are extremely vulnerable to them, and much more likely to become dependent upon them, even using the same amount that an adult might use. And the reason why is that the brain is in a really rapid mode of developing. And, like here you see the average age, 12, most likely to initiate substance use. A lot of times the 12-year-olds may have tried it, and when I talk to kids who have substance use disorders, they'll say, I tried it at 12, 13. I couldn't get a hold of it again, but I knew once I could find it more reliably, that's what I was going to do. They knew at that moment that was the coolest thing, and it made them feel good. And 16, greater sensitivity to the effects, and by 20, increased risk when you look there of kids that tried earlier of actually having a substance use disorder. The reason why is that the brain during that time is making all sorts of connections and pruning things that it no longer needs, as well as hardwiring things in the brain that you are going to need for your adult life. When you introduce something in particular like cannabis, it actually makes more connections, and you would think, oh, that's good, but actually it's not. It's not good to make a lot of different connections. When you diagnose, one of the things we found out about schizophrenia is that there are too many connections being made in the brain. The things that needed to be pruned weren't pruned. So you don't want that to happen, as well as our brain has natural endocannabinoids that are needed to develop executive function, help you to address risky things. And if you put a outside cannabinoid inside of your brain will take the outside chemical over the one that's already in your brain, but the outside chemical does not help you to develop. So there's something very different in what happens to kids with substances. And I could talk about different ones, but I was asked to focus a little more on cannabis. So, that already puts a kid at a disadvantage. So the earlier you begin to use, like if you're 9, 10, we have kids that, start somewhere around there, especially if there's substance in the family. The earlier you start, the more likely you're going to be dependent on it, and the faster you're going to be dependent on it. And then I like to show this because people feel comfortable in learning about protective factors and risk factors. I would say just about every kid is at risk for substance use. I've seen kids with every single protective factor begin to use. I've seen kids with every single risk factor never try a substance use. But these are the things you'll see in the literature. Having a strong family connection, healthy, having good self-esteem, coping skills, feeling safe in their spaces, having positive norms, positive peer relationships tend to help insulate people from taking negative or harmful risks during adolescence. And, ACEs, adverse child experiences, trauma, mental health condition, child abuse and neglect, things that have stressed a young person are more likely to have them look outside to find a solution for that kind of pain if they aren't given other solutions to deal with it. But really, there's no single factor that will say for sure this kid is going to develop a substance use disorder. That's why every child needs to be screened. I've had kids come in. The youngest was a 9-year-old. Her mom brought her in for headaches. And the young lady, she said, when I talked to her alone, hard to talk to a 9-year-old alone, but when I did talk to her alone, she said, do you think it's my mom's pills that are causing my headache? Well, she was taking oxycodone every day because she found that helped her calm down and feel better. And you can imagine trying to find a treatment facility that was going to take a 9-year-old. Her mom had enough of that in the house that she hadn't noticed that it was gone, and she'd been doing it for a year. So you have to, and she had no other, mom had a chronic pain syndrome and had the medications around, but you would not have thought to ask that. So it's real important to keep open mind and really check with kids on what's going on. And we do have a huge mental health crisis that's going on now, and I'm sure in your state, just like ours, our emergency rooms are really overwhelmed with mental health concerns and kids who are feeling like they need, or parents who's feeling like their kids need emergency care for suicide feelings. One of the things we don't talk a lot about that is that the connection between substance use and mental health. It's very tight with kids. Like 75% of kids who have a mental health, 75% of kids who have a substance use disorder also have an independent mental health disorder. So they come together, and when we're talking about kids, I wish that the national dialogue on it would include substance use, because it's pretty hard to work with one without working on the other at the same time. There's a lot of research that shows if you only work on one, you're not going to get the same impact as if you work with both, trying to help substance use and mental health in the same time. So I think it's important to continue to think about that when we have our kids come in and they say they're feeling bad. You've got to, even if they meet strong criteria for major depression, you've got to also screen for substance use. And here's some of the reasons that kids in a more recent study, 2022, say that they use when you ask them. Number one, feeling mellow, calm, relaxed. 73% of kids. Have fun, 50%. To stop worrying or forget, 44%. To make it less boring. I think that's really interesting, because when you talk to a kid, and one of the more common responses they may tell you is, "Oh, I'm really bored. I have nothing to do." That's, you might want to help them find something to do, and to help with anxiety and depression. And again, those are a kid feeling as though they have anxiety or depression. Those are the most common reasons that were found in the last study on this. When you look at specific drugs, you see that for kids who use marijuana, 76% of them say they use that to feel mellow, calm, or relaxed. And prescription pain meds, they're the same thing. Prescription sedatives and tranquilizers, again, same thing, but the motivation for stimulants a lot of times is to stay awake. The one they didn't put here that you see in college kids is to the perception that they're going to do better in school, even though there's research that shows that they do worse if you don't have ADHD and you take stimulants. And for alcohol use and non-prescription misuse, it was to have fun or experiment. And one of the things that you hear, and I know we all hear no matter where you are in the country, is that the drugs that we have now are extremely potent. The research that we have on the outcomes of using these substances are on much lower potency drugs than we have right now. We're only now really being able to comprehend what the side effects and impact is of the strengths of the new substances that we call cannabis. But it's more than a 200% increase. And if you're somewhere like Washington, where I am, or in Colorado, my daughter was, she's in New York, and one of her friends was moving from Washington to New York, and she was asking about the cannabis. And, she's like, well, New York, it's not you might need to try to figure out how to bring your own if you want to have the same level of strength, because the strength in Washington is much stronger than what they have so far in New York. I mean, these are the conversations people have, right? But, it's no matter where you are, it's much stronger than what people had even 10 years ago, 20 years ago. But then, the other part is thinking even about nicotine is much stronger. We have the oils for the vaping, that's much stronger. Opioids are much stronger. And any of them, even cannabis, any of them can be contaminated with fentanyl, with tranquilizers, with benzodiazepines, any of them can be. And that's where we're seeing a lot of the deaths, right? You think you're going to somebody that you trust to give you a substance that you like, and it has fentanyl in it. I've never met a kid who told me they didn't trust the person who gave them their drugs. Everybody trusts their supplier, right? It's their friend. So it begins to be very difficult for people to know when you have this contamination. Now, of course, there's strips there that you can distribute out so people can test their drugs before they use them. They're not as widely available as they should be. And if you think about drugs in general, what are kids really using? Across the world, alcohol, cannabis, and nicotine are the most used substances. Our country uses magnitudes higher substances than any other country when you measure them. But still, it's alcohol, cannabis, nicotine. And we have 2 million young people that are estimated to have a substance use disorder. And so in between trying it once and never doing it again and having a substance use disorder, there's all of those levels. And for some kids, trying it once with something that's contaminated with fentanyl means death. So it's right now in this current time, it's a very risky thing to do. And I do think it's real important for kids to take risks. We have to do that. You have to make the right connections so you can live and be a capable adult. But substance use risk at the moment is pretty fraught with a lot of unexpected outcomes. And so if you look here, we had been going down in past year illicit drug use. Now, remember, both cannabis and alcohol are still illegal for young people, but they're not considered when the country talks about illicit drug use. And you see that there's been a slight increase. We had a dip during the pandemic, and what happened is there were less kids initiating substances, but the ones that were using used more. So they already had a way to get it, that, you know, that was hardwired. They were using more. And what you see here, if you look overall, all ages, opioid deaths have just skyrocketed. And it's primarily because of the fentanyl. Everything else is, you know, a lot of them have increased a little bit, but it's really the fentanyl that's causing all of the trouble. And if you look directly at overdose mortality among adolescents, again, that high number is fentanyl, opioids, but of opioids, it's fentanyl much more likely. And, you know, every week, a classroom worth of young people die of overdose right now in this country. That's a lot. I mean, we have a high school in Seattle where they had 5 empty chairs last year in the graduation of that one high school class of the 5 people that had overdosed and died. You know, it depends on where you are, but it's become pretty sad, you know, because again, this is a preventable illness and way of having being mortality. I think that of this, the most important thing is that most of the time it occurs at home. People are home, they are home, and it occurs at home. I was getting some clothes at the my favorite store downtown, you know, at Nordstrom, and I don't know how we got into it, but the lady began to tell me how both of her sons had OD'd of you know, opioid overdose in the house. And so we had this whole conversation about the fact she needed Narcan, and she hadn't really thought about that, learned about it. You know, they had survived, but she was worried every single day that she was at work, that she would come home and something would happen. So young people, it's at home. People are home, and you don't know, right? There, you know, so it's extremely important to make sure that kids and parents know about Narcan and to have that really available in their purse, in their house, you know, somewhere easy to get it, because it will save your life. And it saves your life. Some people, you know, are very pessimistic. Well, they're using, they're just going to do it again. Well, the thing is every time you save a person's life, then they have the opportunity to take advantage of all the treatments to help them be better. So it is always important. I don't care if you have had to work with somebody 5 times, you have saved their life with Narcan. It's still important to do. You know, when you talk to a pharmacist and they said, well, you know, why should we keep giving it to, because every single time you do that, and I've had kids who have been in the ICU and almost died multiple times, and the 7th time, they were able to mount and work against the disease and have a productive life. So you just never know. It's really important to save every child and be ready to save them every time and not get discouraged. And if you look by ethnicity, the highest number there is American Indian or Alaskan Native, non-Hispanic. In terms of dying, it does layer out by race. Race is in our country something that you know, divides a lot of people. Again, remembering there is no genetic reason why this should be happening. It's all about social racism, a lot of things that have nothing to do with genetics, and that's why you see this layering out, and it continues to do so. One of the groups that's not there that I think is important to remember are young people that come from immigrant families. And again, we use more substances here than all other countries. And so when you're coming here as a parent from another country, you may not even be sensitized to the fact that your kid is using. So I think it's real important for us to be able to talk to our immigrant families and key them into some of this. I'd have kids that would say they were smoking right in front of their parents. You know, the parents didn't know what it smelled like. They didn't, you know, so it's important to talk with families and make them aware. And yes, young adults, if you go 19 to 30, they are using more cannabis and hallucinogens than, you know, ever. And we've been studying since 1976, the Monitoring the Future study. They're using more than ever. If you listen to the news, sometimes it'll say there hasn't been an increase in cannabis use with with legalization or medicinal use, but you got to tease that out. That's not actually the case in the groups that we're interested in impacting. And cannabis in particular, I think, is very interesting. A lot of what we do is very, very political in how we schedule and what's legal, what's not legal. And cannabis has this really interesting history of first being okay. People used it to make twine, and hemp was really farmed quite a bit. Then you started seeing people, that came back, didn't need it for the war anymore. And then you started seeing people begin to smoke it, and people began to get a little worried about it. And, then we had the reefer madness and, all these things, the Guardia report, which said that it wasn't, I'm pretty sure that's the one that said that there was, it was okay, there was no real, it was in response to the reefer madness that, there wasn't really a lot of problem with it. When it began to have more issues is when white upper middle class kids started using it, and that they have more agency, like with the government, right? So they were pushing them to make some sort of war on drugs, which we had, which I, wasn't particularly helpful either. And, then we finally come to 1996 when we had California legalized for medicinal purposes in 2012. And so as we continued to go on, you look, this is the most recent one I could find that was in 2024, but pretty much every state, except just a few, and many of those states are going to do something either medicinal or recreational as well in our country right now. So it's pretty available. And like I said about the scheduling, if we're going from Schedule 1, which is heroin. Schedule 2 is things like meth and cocaine. Schedule 3 is anabolic steroids, testosterone, Tylenol, codeine. That's where cannabis now will be in that category. And, you say, well, how does this make sense? I'm not, it does have a potential for dependence, but then you have to think alcohol and nicotine are not scheduled at all. And alcohol counts for most of the deaths of substances in the world, and it's not scheduled. So a lot of this is completely political. It doesn't have a lot of basis in science. So the nice thing about Schedule 3 is people can do more research on it without a whole lot of difficulty. But the bad thing for our adolescents, if they for some reason are looking at schedules, is that it gives the impression that there's a low risk potential, and that's not actually the case for adolescents or a developing brain. 3 to 4 times more addictive than for teens than adults. So for every kid that begins to use, 1 in 6 is going to have a substance use disorder, where it's 1 in 10 in adults. It's just because the connections have already been hardwired. So you're going to have less of, and that's the same for every drug. It's more likely to have a dependency if you start in adolescence than adults. But at least 75–80% of people begin during adolescence. If you get out of adolescence, early 20s, the chances that you're going to start to use a substance is extremely low. So, let's see here. I talked about most of these things. It is associated with high school dropout. And for a number of years back, we talked a lot about it having cognitive compromise in teens and young adults, which is true. But I think one of the things we'll talk about in a minute is the schizophrenia risk. I think that's much more scary. When I talk to kids about cannabis use, and I'll ask them, well, who's the pothead? Who's the one that everybody knows? And everybody knows who that is in their group. You say, well, that's the brain damage. That you can see it yourself, that's the brain damage. And teens who use alcohol and cannabis together, have many, many more accidents. We know that. And most kids don't use just one thing, right? Most kids don't. So it's extremely common to have somebody drinking and getting high at the same time. And most kids still smoke and vape. It's harder for them, well, it's illegal for them to go to the stores. So, how are they getting it? They're getting it off market. Or they're getting, in our state, it can be delivered to your house, and there's not a lot of checks and balances on age there, as there should be. But most of them are getting it secondhand, because you can't go into the store. And the kids that, different, it used to be if somebody was smoking cigarettes, you thought, oh, let me try and see if they're using other drugs. It's now the opposite. If somebody is using cannabis, you better check about vaping nicotine, because they could be doing both. And of these things, with the mental health, some kids use cannabis because they feel it's going to help their anxiety. Some kids, it's like I see kids drink alcohol to go to sleep, but then they come because they're having trouble with their sleep and feeling tired. Cannabis is the same. It may feel at the moment like it's helping your anxiety, but actually it's tied to increasing anxiety, just like alcohol really disrupts sleep overall. So, kids have more suicidal thoughts. And this is an older side. I said possible risk for schizophrenia in later years. It's not a possible risk. When I was at the Pediatric Academic Society's meeting just yesterday, actually, in Toronto, the Canadian research group, they're able to do something we're not doing in the States. They have cohorts that they've been following. And they can follow people across the country. And I don't have a slide on it because I just saw, I just heard it, and I'd already turned my slides in. But if you are a teen male who are more at risk for schizophrenia than female, and I'm not sure if we know why, but it's much different. And you have not used any drugs, you've gone to the emergency room, you have a point, they were looking at people who went to the emergency room 3 years later. And so if you had no problems like that and you presented to the emergency room, you had a 0.22 risk of being diagnosed with schizophrenia 3 years later. If you had gone to the emergency room, had not had a psychotic event with cannabis, but you were using, and that might have been why you went to the emergency room, you had a, let's see here, 2.87. So that, from 0.22 to 2.87. If you actually went to the emergency room, you were using cannabis and had your first psychotic episode, there's a 40% chance that you're going to develop schizophrenia within 3 years. It's huge, and it's not about, extra stuff added to cannabis. It's the cannabis itself. It's how it is used in your brain. And that's huge. 40% chance versus 0.22 if you're using it. And so the young person, the 14 to 18-year-old has a 41.3% chance if they have a psychotic episode. And that happens. People have those episodes, and then it kind of dies down, and maybe they use it again, and because you keep having to try, well, maybe it won't happen again. But those kids are at real high risk. For girls, if they had nothing wrong, they weren't using, maybe they broke their arm or something, showed up in the emergency room, they had a 0.13 chance compared to 0.22. But if they were had it presented with a psychotic episode secondary to cannabis, they had a 16.84 chance of developing, being diagnosed with schizophrenia 3 years later. So it's really powerful. It's more powerful than the IQ concerns. It's something we need to think about. And when I go and I talk to groups who are of parents who are trying to help substance use prevention in Washington, there are always a number of them whose kids are now, they have schizophrenia. And I didn't see that 10 years ago, 20 years ago. This is because of the potency of the drug we have. And even in adults, the risk of psychosis is doubled. They just have less, again, the wiring is different. They have less of a chance of becoming schizophrenic and diagnosed with schizophrenia, but it is elevated as well, just nowhere near the magnitude. And then when we think about, is there even a use for cannabis? And you could say, well, maybe for intractable epilepsy with kids, although there are other treatments, and I think the big, people were real excited about it. I think that's worn off. If you look over time, it's not necessarily even that powerful for epilepsy. But other than that, there is no approved use. There is no known use medicinally of cannabis for young people, none. And that may differ from the states and what the states have said are medicinal uses, but the evidence isn't there for almost all of it. And so I think we have to, make sure that kids know that and understand that, and parents. Now, when you talk about young people using, again, it layers out by race what happens to them. The young people who are people of color are much less likely to be identified as having a substance use disorder when it's there, which means that they're much less likely to be able to get whatever treatment's available. When they do get the treatment, it's of lower quality and less intensity, and also not really developed for their cultural understanding of their environment and their world. The kids, one of the big reasons 80% of people in Seattle voted to legalize cannabis was because they thought that it was going to decrease the amount of African Americans getting incarcerated for, that's the lobby of the people who wanted to have stores. They really pushed that really hard. And of course, as you would think, it didn't make any difference. It wouldn't make any difference, right? So it's actually worse in Colorado, where they looked at it. African American youth were 3 to 4 times more likely after legalization to be arrested for substances. Because for all youth, it's still illegal. So you can still decide what you're going to do with kids when you see them. One kid I might have and living in one area, the police see him and they say, hey, go home, break it up. The other kid will get shaken down, right, and put in and incarcerated and arrested, depending on where they live and how they look and who they are. So it's important to think about that as you work. I know you have a workshop after this that talks very specifically about how to engage with young people around substances, but I think it's really the same whether you're talking about eating disorders, substances, depression, just about in any area. Really, I think some of the best training is still the motivational interviewing type of training that works really well with adolescents for just about anything. And being aware of your personal beliefs, the slide says leave them at the door. Kids pick up on your personal beliefs like that, right? They can tell, by your body language, how you lean back. There are a lot of things that tell a kid that what they just told you was not acceptable to you. And so you've got to be really, really committed to having a sense of not judging and just listening, especially with substances, with trauma, with trafficked kids. I mean, it's really important because one little pullback, one little, eyebrow raise or pause, and they're gone. They're like, okay, you are not somebody that's safe. So that, I think, to me, that's one of the biggest things that you have to really think about when you're working with kids, especially around this, because there's a lot of stigma. And, being interested, I'm sure everybody in here, you're here because you love teens. People pick up on that. and not being their doctor. Sometimes when we have trainees and, they have gone through this whole thing like a parent, I'm like, you're not their parent. Listen to them. Don't give them, advice that a parent might give, because you're not their parent. You're their doctor and you're their advocate. So work with them on what they want to work on. Maybe you want to work on them not using, but maybe they want to work on their headaches. Well, let's work on the headaches. Likely the substances may have something to do with the headaches, but work on what they want to work on, because you're their doctor. You're not their parent. And all of those things are important. Confidentiality is critical, but it's also critical with this particular area to be clear and let them know the boundaries, right? So you got to let them know that there are some things you tell me. Like I used to tell kids, if you come high to my clinic, I'm going to tell your parents if you're high. One, because it's a danger, because half of them were driving. Two, because it's gone pretty far. And so I've had times where I've had to get the mom who's in the waiting room, bring her and say, your child, he's high right now. Do you understand that? And I've never lost a patient, because you have to tell them beforehand, this is the border. If you come in high, I'm going to have to do, that's a danger. But otherwise, here's the area that we will work in, and you have confidentiality. Make sure that if there's some border you have, that you say it, or else you won't be trusted later. And this is an older slide, but it's the best one I've seen about the impact of parents on whether or not their kids use. That's the most powerful thing that you can do, is engage parents to be aware, to actually say, I don't want you to use, the absence of that, the kid believes that it's okay with the parents. But the parents is the most powerful use. When the kids, on this slide, when this is from Healthy Youth Survey, when kids believe that their parents were not accepting of that, 13, I think it says, % of people used. Whereas when they knew that their parents thought it was wrong, they were not using. Same thing with communities, but it's not as powerful. So it's really important, if you want to have a one-stop shop, to really work with the parents. And let me see. Yes, I have a good amount of time. The thing, and that's where we get into prevention. For me, I'm spending a lot more time. I used to have a treatment, a certified treatment clinic, but now in my current role at the hospital, I don't have time to do that. So I've pivoted really strongly into working in areas to try to get prevention in place. And when I say prevention, I mean primary prevention, primary. So we catch people, everyone, before they use the first time. If they use the first time, you're already automatically talking about secondary prevention, and that's good, but we don't really spend enough time on primary prevention. And we, meaning the country, the little bright blue tiny bar there, that's how much money we have spent on prevention in our country. And you see from 2008 to 2017, it hasn't increased. Treatment, law enforcement, we've, gone all the way there. And then you say, well, maybe it's changed. Well, this is now up till 2023. The dark blue is how much we're spending on prevention. And usually, and even looking at Biden's, I don't know if he's written it now, but for his first administration, current, he talks about prevention, but if you read it, he's talking about secondary, tertiary prevention, not primary. And so most of that small dark bar is really geared toward that, not toward primary prevention. So we don't invest in our kids and the prevention of things, or really trying to give them the vital conditions, right, so that they can thrive. We're not investing there, and we still aren't investing there. And why is it important? It's important because it's 100% preventable. I mean, once your brain changes, you spend the rest of your life working against that, and it's really, really hard. We see people, and you see them on celebrities, where they were off substances for 25 years, and then they go back. Every single day, you have to fight that desire. You get a cold, you get mad at somebody, you get a divorce. All these different things want to bring you right back to substances. So if we can prevent that in kids, we really give them the ability to live a more full life. So when we talk about parents, again, there are many, many things that parents can impact. And one of the cool things, the reason why I show the slide, is that you impact one thing, you impact a few others at the same time. So you don't have to have an intervention for pregnancy prevention, school dropout, violence. You don't have to have all 17 different preventions. You can have one, and it will impact all of those things. And when we're talking about prevention, so it's really important. You can't always you can't really impact a family history of antisocial behavior or somebody's innate impulsiveness, but there's a whole lot of other things we can impact. You see some of them here, like sensation seeking. Some of those things we're not going to have an impact on, but we can have an impact on favorable attitudes toward a problem behavior. We can have parents express their attitudes. Most parents don't want their kids to use, but many of them don't know they need to expressly say something about it and set up a situation for their kids so that that's not the easiest thing for them to use. In terms of actually training parents, there are a number of evidence-based parenting programs that are geared toward this, who have decades of research showing that they have a solid impact. Guiding Good Choices in particular has over 50 years of impact. The people who first had it are now, they're kids. You do the Guiding Good Choices when you're somewhere between 9 and 14 years old. And so the first cohort, they're now in their 50s, the kids are. And the kids whose parents had this intervention when they were 9 to 14 still use less substances, and their kids still use. You can break a whole cycle. So it's important to think about some of these things. There we go. This is Guiding Good Choices. It's 5 2-hour sessions, and that's pretty powerful if you think about it. 5 2-hour sessions when the kid's 9, and that kid is now 50, and they still use less substances. And you wonder, why aren't we investing in having these kinds of programs available for everyone? And strengthening families is very similar. Because of the pandemic, many of these pivoted and now have virtual programs, which again are still showing good impact, but they learned how to translate that virtually because of not being able to meet in person. And then if you think about, looking again at lifetime prescription misuse, this was one of the studies that looked at strengthening families. And so again, these kids' parents had the intervention when they were early adolescents. And you see that the people who had the interventions, those are the blue, and then red are people that they controlled against, it didn't have any intervention. And you see the powerfulness of that, just teaching the parents 7 sessions, 5 sessions when their kids are early. And then as the kids are getting older, it still shows to have had an impact. So, you ask, well, why aren't we bringing it to scale? That's one of the things I try to work on nationally. And what's hard is that, you could say, well, put it in the school. Well, the school isn't a safe place for every family. And people are not necessarily excited about hearing how to raise their children from the school. That usually doesn't go over super well. So, how do you deal with that stigma? Where do you bring it where people can trust that, these interventions, this kind of work, can be given out in scale? And a lot of us have been working nationally to bring it to pediatricians, or it could be family medicine, nurse practitioner, primary care. The studies have been done more with pediatricians, but it's really about primary care. And I would propose that you could do this even in specialty care, because kids with chronic illness are either equal or more likely to use substances, and sometimes they're a forgotten group. So, where can you do this in a hospital system? That's a place where people already trust and get parenting advice. It's already somewhere they're going. And there's a possibility of getting reimbursement. We've been working on that as well. Different states are beginning to try to reimburse. The difficulty with reimbursement is that if it's a universal primary prevention, you don't already have a diagnosis. So how do you get that, reimbursed? So there's work going on to try to help that. So I'll skip that one. There we go. So secondary prevention of substance use is, like I said, the screening, the early intervention, family involvement. Those are extremely important because, if you hear use once, you want to identify any risk factors, encouraging protective factors, talking to parents, and having a system-based approach, so that everybody is addressing each kid similarly, so you have less bias on who gets screened and who doesn't. And there are many programs. There's SBIRT. For a while, SBIRT didn't have a lot of data for adolescents and how well that is effective, but we know it is effective. Screening, brief intervention, and referral to treatment. Anything we do, there was a study, a really old study, that showed anything we do as providers to teens, even just saying you're using substances and this can be harmful for you, is better than nothing. Anything is better than nothing. So it's important to not feel like you are helpless in this, just even having the conversation and talking. The kid very likely will know much more about the substances than you because that's what they do, and they spend a lot of time figuring that out and how to go up and go down, but your interest in talking more generally about the impact of these substances, having a brief intervention if they give you permission to do so, and referral to treatment, those things are really important. And we have a lot of different screens now, and on the slides, if you have access to the slides, I put the links to the screens that don't cost anything. There are a number of them that have been studied. Some are just 2 questions, some are 5 or 6, but these have all had evidence of being able to be used appropriately. And the American Academy of Pediatrics has a whole section, if you go on the website, that talks about screening, and if it's the first time you've ever done this, I think it has a really good website with every kind of comprehensive thing you would want. But when we're talking, again, I just want to, I'm at the end, but I just want to, again, impress upon you that your gender matters, race in this country matters, historical context, politics, social, economic, all of these things matter in how we address substances with people. And some people get more attention than others, good and bad. And I think as adolescent health providers, we have to be really, really vigilant to try to look at each individual child and give them the time, respect, and listen. I've been places where, especially when I worked in some areas that were majority minority, where I've seen practitioners say, they're telling me they're not using, but I don't believe them. I don't believe them. I know they have to be using. I'm like, look, Black people use less substances than other people. Cancel out cannabis, but if they're telling you they're not using mushrooms and all these different things, they're not using them. Listen and believe and work with that kid. I've seen people have huge biases and pressing. You go in for your finger cut and you come out with all your STD and all these other extra things that maybe you didn't need, but they're over screening you. You're being over-screened. That happens to different groups based on their race or language. So it's important for us to try to do our best because we sometimes over-screen one group and under-screen another. And we've got to try to see each kid where they are and listen because these things, like scheduling, and a lot of it has context that doesn't have any evidence base behind it. And I'm really dedicated to trying to have kids have the best possible chance to live and thrive. I think we've missed out on a whole lot of answers to many of our problems because we have not valued our kids and their health well enough to raise these kids that have the potential to help us in this country and in this world. So, remember when we're dealing with this, there's a lot in substance use. There's a lot of bias. There's bias in the medical field. And we, as working with teens, can really change that if we work hard enough. Let's see. And there's some references if you want those. So, no known safe use of these substances in adolescents. Primary prevention can make a lasting difference, and secondary prevention is equally critical. Tertiary is too. We only have so much time. It's important to save lives, and that's why we touched a tiny bit on Narcan. And be aware of the context of substance use in this country. It's very powerful. But I love this field because it's something that we have 100% chance we can prevent it, and when we get the kids and we identify it, we can make a difference in their lives. So to me, it's been one of the most rewarding areas to focus my time in. And I hope you have questions. So I'm done. Or reflections, because again, I'm not in Michigan, so I don't, yeah.
I had a question real quick.
Who's talking? I can't.
Oh, over here. Oh, no.
Up high.
Hey.
Oh, there you are. Okay.
Yep. When talking with youth, is it more appropriate to say substance use or substance misuse, or is there another term?
Yeah. I use, and I was very intentional in saying use. All use is misuse, but when you say the word misuse, it means that there's some kind of use that actually is appropriate use. So I tend not to say misuse. I think the field is moving away from that world.
Thank you for your talk. I actually have just two questions. So you spoke a bit about psychosis induced from cannabis use, and I was just wondering, where's that coming from? Is that just like the increased potency, or is that also being seen in young people that have co-occurring mental illness? Is it also age? Like, are we seeing this in more young versus old? And then I'll save my second question for after that.
Yeah. People have to continue to study it because we've only recently, had such extremely high potency. But people think it's due to the high potency because people have been using cannabis since, 500-600 years. And now we're seeing this in a much more vivid way. And yes, age, because of the developing brain, it's much more likely to happen to a young person than it is to somebody older. There are people who might be at risk, and that's what they used to think, and it was just triggering somebody. But it's too pervasive. It's not just the people who had a risk of schizophrenia. It's others that had no known risk.
Okay, thank you. And then I heard you speak to the addictive nature of cannabis. And I feel like in my experience, I haven't actually heard that anyone say that it's addictive. I'll hear that there's dependency on it. So I was just wondering if you could speak more to that and about the addictive nature of it, if that's like similar to the sort of addiction that you see with nicotine, and kind of like where's the shift now coming from, like dependency to addictive?
I think that's just terminology. But it's always been, one of the things, like there's a withdrawal syndrome, it fits the full criteria. It's just, cannabis is a little, like I call it a slow burn versus like heroin or something, you can be dependent on it. We don't like to use the word addictive anymore, right? Because it's kind of a judging word. That's why you don't hear it as much. So, but you can have a substance use disorder as a kid and use it just, maybe once a week even, once every 2 weeks, because it lasts in the system so long. But what you see is when you stop using it, there's a very clear withdrawal syndrome from cannabis. And so, which draws you back. If you have a kid and they'll say, well, I can stop using for a couple of weeks. I'll say, okay, well, let's see because you can, because it's still in your system. Let's see a couple of months, let's see how you do. Because usually they'll find their way back, the urge to use it. you find your way back. So it doesn't have a lot of direct, you use a whole, except you're talking about little kids, you know, you're going to die from it, but directly. I mean, you might die from a car accident or jumping off a building or something odd in a psychotic fit, but really, you know, it's not that. It just kind of slow burn changes your brain, as a kid, your brain map, you know, but yeah, it is definitely a substance. And you can see, because people keep using it even when it's harming them, and they will still continue to use.
Hi, do you have, over here, do you
Okay.
have any data on the generational transmission of substance use disorder? Like, do you see parents and then their young children or teenagers also abusing any type of substance?
Yeah, they're more at risk. They're more at risk. If you are a family that uses, somebody just did a recent study, they were looking at grandparents, parents, and kids, and they didn't see a connection between the grandparents and the kids if their parents didn't use. You know, like if they're around their grandparents, but they're users. There's a definite connection between the parents' use and the kids' use, which, and not genetic, you know, no, we're talking about just being in the environment. Because one, you know, if you think about it, you look up to your parents. You look up to your parents are using. I remember that as a kid when smoking was fun, and, you know, people hadn't connected cancer, and I was a little kid, they gave you candy cigarettes. I mean, you were waiting to use, to be old enough to get the real cigarettes, you know, I mean, you didn't, it's the way it is. So you're watching your parents who are really cool drink or get high. I mean, you're going to look up to that, and you want to do it because that's what your parents do. That's one thing. Two, the most common place you get your substances for the first time is from your home, from your siblings or from your parents. So, you know, it's being endorsed. So you can break it, and we're doing some work around people who are have opioid use disorders, and training the parents when they're in treatment so that they can break the cycle with their kids. You can do that, but it's intentional. You have to be intentional.
Speaking of opioid use disorder and tobacco use disorder, I'm a tobacco treatment specialist down in North Carolina, and I have a team member that works in harm reduction with naloxone trainings and things like that. So we both kind of have similar roles, and we work together on different stuff. So what I'm realizing is that with this generation of youth coming up, like THC is a big thing, and, you know, like you mentioned it in the presentation, but I don't know of any standard of care treatment for cannabis use disorder. Like, if somebody comes to me and they want to quit tobacco, I know I can say, use this patch and with this gum, and then ask your doctor for this pill. And then if someone is struggling with opioid use disorder, I know that they can use MAT. But is there any existing treatment for cannabis use disorder?
Not a drug treatment, but, you know, cognitive behavioral therapy stuff. I mean, the most common reason kids go into drug treatment at all is for cannabis. So, you know, they're all imperfect, right? You know, 30% of kids are going to be able to be in recovery after every incident of substance use treatment. So it's imperfect, but there isn't a drug that you can use for that one. Okay.
Hi. Kind of a two-piece question. You mentioned that fentanyl and other contaminations make the use of cannabis much more potentially lethal. In your experience, have you found that contaminated marijuana can be found in legal sources, dispensaries and whatnot? Like, is there, like, let's say a parent uses marijuana, and I want to protect the household from potential, like the kid getting their hands on something, is it reasonable to tell the parents only get it from dispensaries because that would be safe, or is it even contaminated in all sources?
Yeah, I think it's probably safer that it's completely safe. I would say no. I mean, it's not really regulated, right? I mean, even, you know, it depends on the state how regulated the stores are. So, but I would say it's probably safer.
From like legal sources contaminated?
Yeah, I'm not sure of any data that shows legal sources, yeah. But I
thank
would
you.
think it would be safer.
Of course.
Yeah.
Okay, thank you.
Hi. Oh,
Oh, there you are.
so from the data that you presented, it seems as though for African Americans that substance use is a lot lower in comparison to other racial groups. So I just want to know if you could speak to like any reasons for why you think that is.
Well, I wish somebody would study it. I haven't had the time to do that. So maybe you could study it. Cannabis stands out. That's equal. But if you talk about nicotine, alcohol, all of those it's lower. And I think it's fascinating because the amount of advertising in Black communities for nicotine is through the roof, and yet it's less use. But there was one man, and I kept hoping he would continue to research, and he didn't, but he did some study, and he looked at, and if you look at the data, you'll see this. In the mid-20s, you see substance use go up in African Americans, like 25, 30, you see it go up. And I wonder, we think about the risk is in adolescents, but maybe we need to be paying a lot of attention to, younger adults and African Americans, because you see the risk go up. You see the use go up mid-25, somewhere around there. So I think there's something there that we should be looking at, because the amount of push in those communities to use, because it's an untapped market, right? So they're throwing all the advertisement there, but it's not really tracking the same. And I culturally, my guess is too, there's less, it's not okay for a kid to drink alcohol in the same way. It's not okay for, kids to use in the same way that I have seen, with when they're non-minority and parents will bring the kegs to the house and have a kegger party, for their teens. That you don't really see so much in the cultural African-American communities I have been around. But I think somebody needs to study it, because it's a different trajectory, would be my guess.
Was there one on the other side of the room? No? Okay. Here you go.
Oh, there, yeah. I can hear you.
We need the mic for the virtual folks. Thanks.
Hi, thanks so much for being here. My question is kind of revolving around the family, and how do you have a conversation with family caregivers who are actively using marijuana and their young people are using marijuana, and how do you provide information, be a supportive person in a non-judgmental way, kind of focusing on, I'm most worried about your young person's health?
Yeah, I think what I've tried to do, and that's many parents in Washington, is really talk about the difference between what happens in the brain of a young person and what doesn't. And sometimes I had one man, he said, I give my kid cannabis because it's the only time I've ever seen him smile. All right, I'm not going to go in and say, you must stop immediately, right? So I was meeting him because he needed a surgery, and the anesthesiologists were not going to do the surgery on this kid because of the risks of smoking cannabis. And so what we did was I got him to switch to edibles. That's what we did. And what was funny is when he switched to edibles, it's kind of his brain woke up a little more, and he started using less himself. But you have to work with people where they are, and then somebody comes in and says, my child has only smiled when they, I'm not going to, hit them hard right in the beginning. You've got to, take them to where they want to go. But yeah, I think it's just really being honest and saying, this is the difference between you using and your kid using. And sometimes when you talk about the symptoms, and people see themselves a little bit, like, they say, oh, well, there's no problem. I've been using for 30 years, everything's cool. And, you start talking about some of the effects you wouldn't want to see in your kid. They realize that maybe it isn't so benign. especially for young people. But it's a process. I don't think, I assume that I'm going to see them. It's going to be a progression, not one and done in one visit. Yeah.
Thank you for your presentation today. I understand that there has been quite a bit of research in the medical use of cannabis, particularly around patients with cancer, autism, maybe a couple other conditions that may be common in children and adolescents. What are your thoughts about that? How does a provider weigh the risk and benefits of that, and what should we be doing to educate our patients better that may have chosen a medical route using cannabis?
Yeah, there actually hasn't been any research for kids. None. The only one is the epilepsy, intractable epilepsy. Even with using it for cancer, that's really, there's no evidence it helps the cancer, right? It can help the nausea, but we have other medications that can help that more. Like it can help a little bit. I think what I do is people is risk benefit, right? You know, where are you with that risk? When I see a kid with intractable epilepsy and they want to try it and their kid is seizing, you know, fine. I mean, that's worse than cannabis, you know, on the brain, and to be seizing constantly, and see if it helps. But there aren't any others. Yeah, people talk about autism. And there is some, if you look online, people will say it helps the actual cancer. There's no research on that. I think people are beginning to try to look at things. And that, again, that's the only reason I could see good about Schedule 3, is we could actually get more research on things. But if you said credible research, there hasn't been in kids. So it's risky. I've had people come in and want it for autism before. You know, it's, I don't know, you know, again, risk benefit, you're going to have some damages to the brain by using. Is that worth the risk, you know, for a possible unknown benefit? I don't know. Mm-hmm.
Hi.
Hi.
Do you have any advice for young people who are trying to help their peers who are addicted to weed or drugs but maybe don't have access to health care or don't trust their parents or the adults in their lives?
Yeah, you know, there are, I'm not here, so I don't, you know, but there are hotlines and numbers people can call. And in every state, a kid can get treatment. Now, the problem would be paying for it, but you can go and get treatment without parental permission for substance use. That hasn't changed. That's most all states. But, you know, it's hard. It's hard. You almost need your parents. It's hard to do something so hard without your parents, but I've had kids whose parents were absolutely against them stopping cannabis, and we still, you know, we were able to get them into treatment. Because they have that right. But it's hard, you know, how are you going to pay for it? And it's really hard for a kid to go against their parents. So.
Okay, we have time for one more question.
Hi, I think you've covered some of my question. Thank you so much. This is wonderful. I'm also in North Carolina, and one thing that I've found with a lot of folks, and I guess this is enlightening for me, but there are so many folks saying that if you use cannabis in the right way, it is good for you. It can help with anxiety. It can help with depression. It can, so, you know, there's, you know, I have peers that I talk to about this in different fields. So I was wondering what your thoughts, and I know for adolescents, the brain issue, but do you see any benefit to using cannabis for anyone? I think that's...
Adults have a lot of things they do that are completely unhealthy. So I just, you know, I don't know that that's worse than any other thing that they do. So I just leave adults in their own little bag to do what they want. But you know, kids, yeah, there's no, I mean, it causes anxiety, right? Depression, it's equivocal. absolutely causes anxiety in kids, right? So it's not, and it disrupts your sleep, right? People take it to sleep, but it causes you not to have your level 4 sleep, right? And so if you don't have that sleep, you're not going to dream, and that's one of the things I ask the kids: are you dreaming? Because if they're not dreaming, again, they're using it enough to disrupt their sleep. So even though their eyes are closed, they may be unconscious, they're not getting restful sleep, which causes all kinds of problems for them, when they're awake. So I begin to, you talk about those things. For adults, I'm sure there's some of the same, but there's all kinds of things adults do. The thing is, you want to bring the young people along so that when they get older, they can make good decisions and they have a good brain to make those decisions. I just let the adults do what they do.
Thank you, Dr. Leslie.